Good evening and welcome to Smart Entrepreneurship Decoded on Transcontinental Times. We have had a fascinating journey over the last 23-24 weeks, hosting people from the startup ecosystem who share their insights with us. We have had people from every aspect of the system. Tonight, we will be discussing a completely different sector. A lot of us have been bombarded with the success of Medtech in India, even pre-pandemic, and the pandemic seems to have only accelerated that. Medical tourism, parallelly as a service, has grown into a $2 billion business in India, and we rightfully pat ourselves on the back for that. But what is lesser known is the medical equipment and devices industry, which is about $12 billion now, growing towards 50 by 2025. What is lesser known about that huge sector is that in the high-end medical devices, 80 to 90% of the devices are imported. Think, if you yourself have ever had a surgery or have had a CT scan or an MRI, did you see an Indian machine? You definitely saw an Indian doctor, maybe even if it was outside India, but not an Indian machine. But a lot of brave startups are trying to change that. The startup movement in India started with ideas largely in the services sector. Look at the IT sector, mostly services. Do you know a single product globally known that has come from IT sector? Not yet. That day will come. Most of the startups have been successful in the services sector, even food delivery, the latest IPO. Why do Indians not get into the product side? Why do they not get into this longer life cycle of research, development, but a hugely better paying sector on the product side? Tonight, I have a guest who can help us with that. We have Ravikiran Prabhakara, who is unique in the sense that lives in the city of Bangalore. Now, many of us who live in the city of Bangalore often joke that you throw a stone and you'll find a techie. But what is lesser known is if you throw as many as 83 stones out of 100, you won't still hit a Bangalorean because there are only 17 out of 100 of them. He is one of them. He was telling me pre-show that out of all his extended family, only one lives outside of Bangalore, and that too in Mysore. He's a true Bangalorean. If you've not met one, tonight you're meeting one, and a very accomplished one at that. One who's worked in the US for a long period of time, is highly professionally accomplished, and then started the journey into consulting, investment, and largely focusing on the medtech sector. Welcome, Ravi. Welcome to the show.
Thank you, Nalin. Thank you for having me on the show.
So talk to us about the point I was ranting a bit about, right? Why do startups stay away from the product side of businesses? So it is changing, but why do they do that?
See, I think first of all, as you rightly said, when people invest in businesses, the VCs, the PE funds and stuff like that, they're looking at return on investment. And typically on the product side, the return on investment, the cycles are much, much longer. Now, if you apply that to the medtech space, medical devices, it's even worse. Okay. So if you can think of a mobile phone or any other white label, white good consumer product, every year you have a new release, a new launch, right? I mean, you have an iPhone that is launched every year. It's typically about a year for a new product to come out in that space. For a medical device to come out, the minimum time required is about 3 years. And I'm not talking of devices like the big ones, like the MRIs, the PET scanners, or the CT scanners. I'm talking of the regular ultrasound type devices. The life cycle is about 3 years.
Why? Now, is it the testing and the certification, or what is it?
Yes. So there are multiple aspects to it. The first thing is when you're thinking of designing and developing a product in the medtech space, you're talking of a highly regulated space. It is not the same as a consumer good where you can come up with a product 6 months, but you're entering the space, you're entering the domain where the regulation is very, very high. The ideation, the industrial design itself takes about a year and a half. Once that happens and you get the go ahead, then you get into the actual engineering design, testing, and regulation. From the time you go to a notified body to get a certification for, say, a CE certification or a FDA approval, you can be waiting from anywhere between 6 months to a year in getting an approval while you're doing nothing. You're just waiting. You have done your clinical trials, you've submitted all the documentation, you've done your testing, you've submitted the information, you've done everything. And you're waiting for 6 months to 1 year, just getting a confirmation saying that, yes, this is a go. Or they come back with more questions and they want more information. So the typical life cycle of a medical device is about 3 years. And if you look at the typical VCs and PE funds, right? I mean, they're not going to wait for 3 years for something to come from the pipeline, let alone whether you know it works or not.
At least not in India.
Not
So,
in India.
so what's happening in the medtech space in India? What's exciting you? What's keeping you busy?
See, I tell you one thing. I think in the intro, you hit the nail on the head where people talk about medtech, people talk about healthcare, right? I mean, medtech is a small component of the healthcare space. And you're very rightly said. I mean, we have excellent doctors, but 9 out of 10 of the machines that they touch, they use is imported.
True.
And the typical thought process has been copy paste, right? Copy it,
Yep.
paste it, or get it here, import it, use it. Not anymore. Uh, at least in the medtech space, even amongst the big four, right? The GE Healthcares, the Siemens, the Philips, and the Medtronics of the world, they have something called in country for country,
Okay.
where they're focusing on designing and developing products within the country for the country. And this they realized quite some time back. And we are seeing the product introductions of devices that have been designed and developed in India now. But what has also happened, and this is one of the main reasons why I also moved from a corporate career into an entrepreneurial space, is uh, there are a large number of smaller startups, entrepreneurs who are coming up with products and services right from the ground up, understanding the specific need for the Indian market and launching products. And this space is only going to go up and it's going to boom. And there are some very phenomenal use cases, very phenomenal devices that have come out of this ecosystem from India that are actually addressing such problems.
Okay. So I had a similar experience, in the last few years in the India Fund Fest. We get medical device founders come. Mostly I found them from the Nagpur, Indore area. I don't know if you've ever been there, but you can walk through Nagpur and Indore and see streets and streets of diagnostic clinics, because in that central part of India, that seems to be the hub.
Correct. So I think you're right. You see a lot of that more from the service side of things,
True,
but I
true.
think a lot of the product based companies are, I would say, a majority of them are based out of Bangalore, and a lot of service based organization more on the high tech side, not on the device side. So as you mentioned, the Nagpur side and quite a few places in the north, it's more as a service, like diagnostic centers,
Yes,
scan centers,
true,
and so
true,
on and so
true.
forth. But again, if you look at the more high tech service side as well, like telemedicine, a lot of those platforms, AI for radiology and stuff like that,
True.
they're all based out of Bangalore. Most of them are based out of Bangalore. So a lot of that
Absolutely.
innovation I feel is happening from Bangalore.
That's true. Bangalore has turned up to be a hub.
Sure,
Where I live, it's supposed to be the R&D hub. Although
sure.
driving on it, you would never think you're in a city. You would think you're in a village.
Yes. True.
So, all over the world, industry partners with entrepreneurs
Mhm.
in various sectors, right?
Right.
Is big pharma in India partnering with medtech to tell them things they should develop, or are they accelerating them or incubating them? Anything like that happening?
Yes, a lot of that is happening. A couple of the big four companies are doing hackathons, and they're looking to nurture and grow these startups. But what is also happening is there are quite a few of these startups that have come up with some phenomenal products and
Okay.
or services, and the big companies have just bought them. So I can give you one example without going into some specifics.
Sure.
So if you look at a typical mammography, right, a mammogram, a lady has to go get a mammogram in a typical clinic. Uh, you may think that in 2020 2021 it is okay, but even in places like Bangalore, which is, I would say, in the forefront of a lot of this stuff, not many women go and get a mammogram, especially after 40. They don't go
True.
every year and get it done.
True. True.
What if you can come up with a technology that probably works on a different idea or a principle, and it's, say, a handheld machine, and you can go to the place where you find, or you have these women present, and do a scan. So, for example, there is a company in Bangalore that does just that. So traditionally, a lady would have to take an appointment in one of the big hospitals, go there, go through that entire process, wait for the result, and come back.
True.
There is a company that uses a portable handheld IR scan, that
Oh,
you basically go to a corporate company, you tell them, give me a conference room, cover everything up, and women can just walk in, they go through a screening, and they get the result right there. It's literally a 5-minute job. And such a company was there, and it got picked up by one of the big four companies. So a lot of such amazing innovations are happening, but they are very, very few. And as I said, this space is just going to explode. It's going to take off. We are very, very well poised. And even the big companies have understood that the copy paste model doesn't work, the
true.
jugaad model doesn't work. Because we are in a highly regulated environment, it is innovation from the grounds up, and that is happening.
Yeah, I find this whole jugaad thing a little insulting. I keep
It
telling
is.
entrepreneurs that if you keep a jugaad mindset, really, you can only become a good mechanic. Beyond that, it's not going to work.
I
It
agree.
is. It is. I think unnecessarily amplified and glorified because
Yes.
of a few rare success stories where something worked because of
Correct.
luck, fluke, and chance, partly,
Correct.
and
Correct.
partly somebody's skill maybe. But it's glorified, and the young people think, oh, that's a way to go. That jugaad is a strategy. Jugaad is
Correct.
not a strategy. Jugaad is a compulsion.
Correct.
It's not a
It's a
choice.
compulsion.
Cannot be your first
It's
choice.
correct. And especially in a space like medtech, it's not going to work. In such a highly
Absolutely not.
regulated market, it's not going to work.
Yeah. Medtech also requires big bucks. So, is with this long life cycle thing, are VCs and funds looking at it differently now, or are medtech companies still struggling for funding?
No, so I think there are two things that are happening. Yes, I think the traditional VC, PE funds are still very hesitant to invest in such long lead, long cycled programs. So one thing that is very significant about this particular domain is you will typically find strategic investors, just not investors, but strategic investors who will not only put the money where their mouth belongs, but also they will open up doors. They will make the connections. They will make sure that the money that they're investing is just not for an ROI in whatever 5 years, 10 years, but they're also being strategic and they're adding value along with their investments. And I think even the medtech companies look for strategic investors. They typically don't go to the investors. They look at strategic investors.
So, are you one of them? Do you
Yes,
invest heavily?
absolutely. Yes. So I went from a corporate life to an entrepreneur to an investor and then mentoring. So if you see my LinkedIn, that's what I put, entrepreneur, investor, and mentor. So yes, so because I'm part of this particular space, I understand that if there is a great technology out there and it's going to succeed, um, being part of this ecosystem it's not only our job to support, but I mean, why not? I mean, there's going to be great returns at the end of the day. So yes, I've invested in a couple of companies for which I will see the return on investment in some time, but I know they're going to definitely succeed.
So you have seen this movie from four sides of the table, right? Consulting,
Yes,
working, entrepreneurship, funding, mentoring. You
yes,
so you have a pretty clear view of how this whole thing works. So let
yes.
me ask you. I ask almost all investors this question because I get it from founders all the time. When you meet a stranger for the first time who's pitching you an idea, what is it that you look for, or what is it that piques your curiosity that, okay, I'm going to speak to this person again? Of course you'll speak for a long time, but the initial interaction is like a speed dating, right? 30, 40
Correct,
seconds you make up your mind whether you want to talk to this person again or not.
correct.
What is that you look for? What triggers you?
I think there are two things I definitely look for. One is it becomes very easy for you to know whether they're fishing or they're hunting, right? When they're trying to raise capital, one of the common mistakes that startups or entrepreneurs do is they fish, right? They throw their net everywhere, they throw their line everywhere, and they'll see who'll catch. It's not going to work. You have to be very clear in who you want to bring on board,
That
who's
means
going,
match to investor philosophy and then woo them the right
and
way.
who them. Yes, so that's
Much
that's
like
the
you
first
would
thing.
do on shadi.com for a life partner, right?
Absolutely, absolutely. And second thing I look for is the hunger, right? I mean, the passion that they have. Um, Entrepreneurship is not the glammed out version of what a lot of people say, right? You're your own boss, you work on your own schedule. Yeah, all that is fine for a little while, but then when the rubber hits the road, it really starts hitting you. And
Yeah.
it's not easy to keep the idea or the startup going if you don't have substance, or if you don't have that hunger or that passion. So I look for that hunger and that passion to really see whether this person knows what they're doing. And when they get up every morning, they want to go back and do it again, and
Yeah.
do it again, and do it again, and do it twice on Sunday, right? If they don't have that passion, if they don't have that focus, then I think it becomes very clear that I think they're just in there for the glam, or they're just like a flyby operator and they're just going to fade away.
Yeah. That is an unhappy thing that has happened, that a lot of people are in it for some kind of a social recognition.
Correct.
I keep saying that when I was younger, if I said I wanted to be an entrepreneur, people would look down on me. Today,
Yes.
parents walk around proudly saying their son or daughter is an entrepreneur. And if by
Yes.
chance they've got funded, they are like royalty. So
Absolutely.
that's a
Absolutely.
social change. But to the point you were making about being your own boss, having flexible timing, entrepreneurs don't understand that actually, once you become an entrepreneur, everybody is your boss. The
Yes.
client, the
Yes.
shareholders, the
Yes.
employees, and your responsibility is so high and
Correct.
accountability is so high that it's
Correct.
worse than having a single boss in a large company. There, you can
Absolutely.
at least have somebody to go and complain to. Here, there is
Absolutely.
nobody. The buck
There's
stops with
nobody.
you.
Yes. You
And
fend for yourself. You
yeah,
do everything.
yeah,
I think I've seen a couple of your other talks before where they say, right, you're the CEO, you're also the chaprasi, you're also the security guard,
president to
right?
peon, you're everything.
Yes. You're
And this
president.
whole concept of having flexible timing, you very soon realize it means
Yes.
24 bar 7.
Yes.
You are now working for everybody around you who's a boss 24 bar 7. You don't even have money to pay them. You have to beg them to still deliver to the optimal skill they have.
Yes. Absolutely. Yes. It's true.
Okay.
So that's what I keep saying. I mean, as I said, I've done that. I've done that journey from corporate to entrepreneurship. Um, if you're not ready for it, if you think it's just glam, don't do it. You're going to learn very, very quickly.
That's very good advice. Just as we speak, Bangalore is pouring down again,
Yes.
as if the roads and the situation was not bad enough.
Correct.
So today, actually, I went to Commercial Street maybe after 20 years. I
Uh-huh.
was shocked at the way it is kept and of the flooding. And anyway, that's our Bangalore. That's what it's turned out to be. Let's move on. I
Yes.
want to pick your brain on a point you made, a very interesting point.
Sure.
Entrepreneurs must do the hard work and find a matched investor. A matched investor, to my mind, is somebody who is interested in investing in that country, that state, that city, that stage of company, your kind of entrepreneur in that industry, in that stage of business, and has the money now. When you put all of that together, in my experience, you land up with 3 or 4 people only.
Correct.
And so, what is your advice to people? Say medtech, entrepreneurs in the medtech sector. How do they find matched investor? Are there associations? Are there things? What do they do?
So there are a couple of funds and there are a couple of private equity players, but I think you must have this experience too. The moment you know these are the people, I'm pretty sure you also get flooded with pitches and pitch decks by the loads, by the tons, right? I mean, I get probably 2 or 3 a day, maybe 10, 15 a week, about 50, 60 a month. It's not humanly possible to go through all of them. So what I tell entrepreneurs or startups is, first and foremost, do you really want to raise capital because you want to raise capital or you have to raise capital? Answer that question yourself, right? I think you had mentioned before that a lot of the entrepreneurs think it's their birthright, right? Funding is their birthright. It's not. And lot of entrepreneurs make this mistake of, okay, I'm going to raise funds. It's like, why? Are you in need of that capital right now? Because what a lot of entrepreneurs don't understand is it's a lot of hard work, number one. Number two, it takes a lot of time. And number three, even after doing the dance for a very long time, you may not get the right investors. So you should be prepared for all of this. And I think there are certain metrics if you hit, at least in the medtech space, right? Again, think about it. If you apply this concept to a e-com or a service-based organization, it's more easier to tell the story. But if you're a medtech company and you say, hey, I have this idea and I'm going to come up with this device and it's going to solve this problem, who's going to fund you? Right? I mean, I have companies that have come to me that have told me that they have this amazing algorithm that they're going to apply in a machine that's going to solve the issue of blood glucose levels without any issues, without the prick. And I'm like, you guys know what's going on? I mean, Apple and a lot of these others have spent a couple of 100 million in a couple of years, and they've not been able to solve it. They're just coming out with products now. So with a concept, how can you go convince an investor to give you money? So first thing is, be at a stage where you have a proof of concept or you have clinical trials where you can show that this is the exact problem you're solving and here are the results. That's when I would say start contacting strategic investors.
So basically have a prototype or minimum experiential product.
Minimum viable product, yes. A minimum viable product with some clinical data.
With something to say that, yeah, this thing works. And if you work more on it, it has potential.
Yes,
at least bring it to that point.
Absolutely, yes. That's when you go and you talk to people. That's when, again, as I said, it's not the same as going to a regular investor. You go to a strategic investor, they will understand that, yes, you've put in the hard work, you've done the groundwork to basically get the product to a stage where it can be funded. They see merit in going for certifications, putting money for testing and certifications. They're willing to wait that time period to get the approvals from the regulatory bodies, and then they go to market. So till you are at that stage, don't approach VCs. Don't try to raise funds.
I'm going to ask you a bit of a larger picture question,
Sure.
a philosophical question. With an aging population that India is going to have over the next 20, 30 years, with the sector, just the medical devices going to $50 billion by 2025, is it not a strategic enough sector that maybe the government should step in for early stage funding on an exclusive basis, right? See, EdTech gets funded because returns are quick.
Correct.
Agri-tech gets funded because food is a necessity.
Correct.
But why not the same thing with medtech? Why not have funding there?
So I think the government is doing quite a bit in this space. So for example, at least in Karnataka, you have the C-Camp, you have BIRAC, you have BBC, that's the Bangalore Bio Innovation Center. You have quite a few of these organizations